Since the FDA granted emergency authorization of the Pfizer COVID vaccine for children ages 5 to 11, more than 2 million children in the U.S. have been vaccinated. Public health officials are highlighting the importance of providing vaccine access to low-income and minority communities that have been hit hardest by COVID. Stephanie Sy visited one of those communities in Phoenix, Arizona.
It's a busy Saturday morning at the Mountain Park Health Center in the Maryvale neighborhood of Phoenix. A few dozen parents have flocked to this vaccine clinic to get jabs for their children. Some kids made it look easy. Others were understandably nervous, especially the youngest ones, which included 5-year-old Gustavo Carrasco. He's a cancer survivor who's currently in remission. His mom, Janet Esparza, wanted to be there on day one to get him vaccinated. The pandemic upended her life. She quit her job, worried about bringing the virus home.
He never left. He was in the house unless it was absolutely necessary to leave.
10-year-old Rosalinda Ibarra, who has asthma, came with her 2 younger brothers and mom, Janet Villa.
My grandpa, he's the one who got COVID.
Her grandpa wasn't vaccinated and died earlier this year.
That's why I came and brought them so they could get the vaccine. I got it because what happened to my dad. At first, I did not want to get it because I was scared and everything.
So many families have lost loved ones in this low to moderate income, largely Latino neighborhood. This community health center is on the front lines. Janie Pearl Starks is Director of Equity, Diversity, and Engagement at Mountain Park Health Center.
It's a very vibrant community, and it's also a community that has a lot of needs. And so there aren't the systems of a lot of other healthcare facilities. There's a lot of poverty in Maryvale. There's a lot of people working several jobs. There's a lot of multi-generational families.
At one point in the summer of 2020, Arizona had the highest rate of COVID cases in the nation, and Maryvale was particularly hard hit. Now, public health officials worry that the same systemic barriers that led to that may prevent parents from vaccinating their children.
I go to work like 3 in the morning, and I get off about like 2:30, 3 o'clock in the afternoon.
With a truck driver's schedule and caring for multiple grandchildren, the vaccine simply wasn't top of mind for Ray Dixon.
I've been talking to some people about the vaccine. You know, a lot of them say, Ray, yeah, go ahead and get it. It's all right to get it. And some of them say, well, man, you don't need it. You ain't sick. You don't need it. I'm like, so they got me like confused. I don't know.
What about the kiddos? Did you know that they just approved the vaccine for children ages 5 to 11?
No, I didn't even know that.
You didn't know that? Okay. This is the challenge in neighborhoods like Maryvale. People may not have time to go out of their way to get the vaccine. And health officials say patients are getting mixed messages about it, and rumors are spreading faster than facts. It's why Mountain Park Health Center is sending outreach workers to knock on doors. They're connecting people with providers that can answer their questions and even help make appointments for them to get the vaccine. They've met mixed success.
We're going to be knocking on doors. We're going to be talking to people and trying to further that trust, because just as the folks who are already vaccinated want their kids to get vaccinated, we also know there's a lot of adults who aren't vaccinated yet who don't want their kids vaccinated.
Benino Martinez was just getting back from his job when outreach workers approached him in his driveway. He said he was worried about the virus and its spread, but still hadn't been vaccinated.
I have friends who've gotten sick after getting the vaccine.
The language barrier with Maryvale's large Latino population is another barrier, according to Pearl Starks.
We have seen that where in English a lot of the misinformation or disinformation gets fact-checked and gets blocked out on social media. That doesn't happen in Spanish.
Just more than a third of Latinos in Arizona have received at least one dose of the COVID vaccine, compared to more than half of white Arizonans, according to the Kaiser Family Foundation. As dusk approached, we met Artemisa Castro with one of her 5 children. Joanne is 5, and she plans to have him vaccinated as soon as possible. But her husband is adamantly refusing the vaccine.
Some people say that they are putting a chip in your arm. I don't know, to be honest. There are so many rumors, and my husband believes all of them, and not that the vaccine is actually working.
The microchip conspiracy theory is just one bit of misinformation Dr. Mandy O'Leedon battles. Microchips are not in the vaccines.
This is Joe Anthony. All right. Hey, big guy. High five. The hard thing has been, I think, for me and a lot of our providers or physicians here has been being able to battle the false news or false information that's being, heard out there. I want to meet them in the middle, but also let them know, as your pediatrician, this is why my recommendation is what it is. Otherwise, it does sometimes come down to a lot of frustration.
Frustrating because the pediatrician has seen how COVID has ravaged this community.
Aside from the number of cases, we've been seeing also parents get affected from even like a work standpoint, schools being shut down, schools going online. I've seen it hit across multiple levels. One of the areas I think that I've seen it really hard that has struck me is the adolescents, our teenagers, and their mental health.
Public health experts say vaccinating children is also important for protecting the most vulnerable, as the Delta variant continues to threaten the elderly and people with underlying medical conditions, even those that have been inoculated. 5-year-old cancer survivor Gustavo Carrasco can relax now that the jab is over. His mother has that vaccine card in hand. For her and countless other parents, the child COVID vaccine was long anticipated and offers a path towards some much-needed normalcy. For the PBS NewsHour, I'm Stephanie Tsai in Phoenix.